And so with that, we will open it up for questions.
Governor, while you note that there have been some positive trends like the downward hospitalizations in the state overall, there have been continued spikes in rural areas like Dickinson County, Buena Vista County, kind of showing that the state wasn't able to get out ahead of them. The spikes are already happening and you're more reacting to them. Do you have any plans to change your strategy and like actually trying to prevent those spikes from happening?
I say actually we are reacting to them. So when we start to see a spike, or we know maybe there's a manufacturing or business that could be a potential hotspot, then we move testing in there, and we do very aggressive testing, whether that's through the PCR diagnostic or sometimes through serology or both. And it really does allow us to get in there, start the testing, identify who's positive and who's negative, start to, inform the community and the businesses. So most importantly, we can keep them up and going, but protect the health and well-being of their employees. And it's been really instrumental in us being able to provide employees the confidence that they expect and need when they go back to work, to not only know that they have the appropriate PPE in place, but also to know that with the testing, who's been tested negative and who's been tested positive, we can separate the lines and really move forward through that perspective. I don't know, Dr. Padati, do you want to talk a little bit about how that works?
Yeah, thank you, Governor. I think it's a great question, and again, I think I would add by saying, of course I don't ever want anybody to be sick, but I think that when we see those numbers, in some ways that's telling us that what we're doing are directing our resources appropriately, right? So part of what we want to do when we start to hear about people who are ill is offer support, and we do that in public health in a variety of ways. We do that by offering control measures like telling people to stay home when you're sick and stay home if you're exposed to somebody who is sick. And then also evaluating the people you've been around and directing the testing resources that we've been able to increase across the state in those areas. And so when you find those numbers, again, of course, I wish that nobody was sick at all, but having that information helps us to know what's going on, helps us to further direct those tools, further provide resources so that people have that information and they know what to do to take care of themselves and their families and their communities.
Thank you.